Hi, everybody. Leslie M. Thornton, Hypnosis for Permanent Weight Loss. Today, I am joined by someone who I was just on her podcast, Dr. Franchell Richard. We had an awesome, juicy conversation. And personally, I'm super excited about our stars being aligned just because it seems like we have so much in common with what we're passionate about and where the medical system is falling short for people who have weight issues. And that is in the area of mindset. So Dr. Franchell is the Chief Medical Officer at Fresh Try, and she is an author, speaker, and consultant, and a bariatric surgeon. So thank you so much for being here. Thank you. Thank you.
Yeah, no, I'm excited to be here, and you're exactly right. So I'm excited to talk about this topic. It's a passion of mine.
Yeah, really good. And I want to hear about how the passion started for you. Before we do that, I know I had mentioned on your podcast about how recently I went on a retreat. I hosted a retreat for our Hypnosis for Permanent Weight Loss clients, and two of the women that were there shared about how they had had a gastric sleeve surgery in the past and how they lost the weight and had good results at first, but then they ended up over the years finding loopholes despite, how could they still binge? How could they still eat without throwing up because of the surgery and how that affects the body? For myself personally, when I worked in the ICU, I took care of some patients post-op who had gastric bypass surgery, and one of our nurse managers actually had the surgery, and another nurse so I, Dr. Franchell, heard a lot of the negatives. I saw a lot of the really poor outcomes that happened, although I know that there are some positives for people as well. And the one thing that my clients were saying who had the gastric sleeve, who found me years later after they put on, I think they were saying, they lost 100 pounds and they put back on like 50 or 60 or something like that. And they were saying, it was something I saw on My 600-Pound Life, that show that's on TV, where the woman said, the doctor can fix my body, but he can't fix my mind.
Yep.
And all my clients said, that's exactly it. I found the loopholes and I still was mentally obsessed with food. So I'm curious, I am assuming that you see the same thing. Could you tell us your story? How did this become a passion for you?
Yeah, so that's exactly what I saw. So weight loss and obesity in general became a passion early on, but the mindset stuff didn't come until later. So I'll start with, I saw the same thing you did. So I was a surgery resident. And as a surgery resident, we rotate through all the different types of surgeries. So vascular, orthopedic, general. And I remember, and this was 20 years ago, probably now. And I remember even then, like a lot of the root causes for whatever, the knee replacement, the taking off the limb because diabetic and obesity was always a part of that, like equation, gallbladder disease, you know what I'm saying? Wound infection, whatever it was, that always played a role. And almost like you in the hospital setting, it's always negative, right? Like it was never like positive. And during my surgery rotations, I asked my chairman, can I rotate on with a weight loss surgeon? Because that wasn't even offered. And he at first was like, no, you have to do this on your own time. And anybody knows internship and residency is very tough. So, but I literally made time because I was just interested in this. Like, if this is potentially causing all these problems, I want to be the person that fixes that, not the person that cuts off the leg, not the person that takes out the gall. Like all of these are like not the knee replacement. These are all like end result things. Like I want to be the person that prevents that result. So that was my initial first thinking into why do you want to rotate with these weight loss surgeons? And so I did it, and I noticed, liked it because it was new-ish. It was laparoscopic, which we didn't do a lot of weight loss laparoscopically then when I was training. And it was very innovative. And so I got to meet more of the patients as I became more senior in my residency training. I got a whole month to be with them. And so it was during that time where I actually got to meet the patients. And it was a very risky surgery then. And for these patients to be willing to risk their lives, Like a lot of the bad stigma that's on obesity patients and the weight bias is just ridiculous. And in my head, I'm like, these people are willing to risk their lives to get this surgery to get better. Like they want to do this, like, you know, and so my heart really went out to them. I feel like that particular population was labeled wrong. They were judged wrong. And I feel like a lot of that happened to me growing up. You know what I'm saying? Like, who's this kid think she can be, you know? And so I felt really kind of connected to them in a separate way. I never struggled with weight, but I felt like as a whole, they were labeled and judged wrong. And I felt like growing up, that happened to me a lot too. And I almost wanted to be their voice or speak for them. So that's what got me into wanting to be a weight loss surgeon.
Yeah,
Go ahead.
If I could pause you for a second, I just appreciate you sharing that, because, you know, what I really hear is like, and this is what happens, especially when we have like a passion-based, you know, what it is that we do for life is like those things that happen as a kid. Like for me, you know, being in diet mentality and constantly struggling with food, body, and weight, and it being like this mental obsession, like day in and day out. And I saw the patients with that same exact struggle. And me having discovered the hypnosis and being like, this is where my passion lies, because I understand exactly what that person is going through. And what I'm hearing for you is like, maybe you didn't feel understood as a kid, or you were misrepresented, or you didn't have that voice. And you just saw that these people had, like, maybe they were silenced a little bit, like they weren't able to really speak or act or do what they really needed to do. And I love that you stepped in there to kind of, you know, be that for them, which is where the passion lies. And same thing, what you were talking about. I mean, I have the same exact, I mean, our paths are so like in resonance in so many ways, but to see like exactly the same thing, like on kidney transplant, it was the diabetes that caused the, you know, amputation, that caused the, you know, the kidney, you know, disease, like everything was related. And it's like, but wait, guys, like we're missing the piece here. Like what's happening? And like, obviously there's never not going to be a need for tertiary care, for hospitalization, for these surgeries. But because it sounds like for both of our passions of like, I can help people before it gets to that point, it's like we were meant to do that other thing. I would watch other nurses on the kidney transplant unit who were working with such integrity. Like they just like, they put their heart, their soul, they were so passionate about the kidney transplant patients. And what I saw, like, of course I love them and I did a fantastic job, but there was a difference there. And what I saw was the best nurses, they either had a kidney transplant themselves, they had a family member who had one, right? They personally had dealt with something like that, which had them operate with such a high level of integrity. It was like, I need to know that I'm operating with that same level of integrity with the work that I am doing. And I just personally can't relate 100% to this surgery, to people who are, you know, getting this tertiary care. What I could relate to is like not wanting to use medication if possible, and not wanting to have really poor health outcomes later that I could have prevented. So yay for prevention, yay for us following our passions. And I'll let you continue now.
Yeah, no, exactly. No, thank you for adding that. And so you're absolutely right. So that's where it was sparked for me. The mindset did not come in until later. So then fast forward, I was in private practice after all of my training, additional training in weight loss surgery. So that was separate from general surgery training. And then I started my private practice finally, because I was in a previous practice where I felt like it wasn't being done the way it should. And I was green, so to speak. Even still, I'm like, these are patients, not numbers and surgeries, right? Like, and so I branched off, started my own practice. And that's when I started to really get to know my patients and to know that mindset was a huge part. So when I first started my practice, I did typical bariatric surgery. You need to have your nutrition visits. You need to have your eval, your psychological eval, almost like all the boxes to get checked, to get insurance to cover. And it was probably several years in that I was like, I'm doing this surgery that I thought was going to like resolve all these things, and it's not resolving all these things. There was literally an aha moment for me when I had a patient who had all the medical problems, chronic kidney disease, 4 blood pressure medications, insulin for her diabetes, already had a bariatric surgery, And I was giving her a second, like a revision, what we call a revision, when we have to do another surgery if they've already had one. And I gave her what's the Taj Mahal of bariatric surgeries. It's called the duodenal switch. There's nothing above that as far as, surgeries. And so it really did help her for probably 2 years straight. And part of that is because when we do bariatric surgery, you're forced to kind of like what you said, you throw up, you get sick. Like if you go against the way it was supposed to be, your body responds, right? So you have almost like additional tools to help block for a while. And then those go away after a time. Cause you're right. Like you said, loopholes are found. This particular patient had a trigger in her life, family, environment, and triggers could be divorce, loss of job, move, like big things I get. And it just went downhill. Like she started regaining her weight. She, like what you've experienced with patients, she found ways to kind of eat around what the surgery was doing for her and started gaining weight. And even when I saw her after the fact, she knew. I said, your blood pressure is going to come back. Diabetes is going to come back. We were sitting there each month watching the numbers rise. And it's like she could not put like a stop on this. And as for me, I realized the surgery that I did, her mind was stronger than the surgery that I did. And it was an aha moment for me because surgery, I was trained, in this surgery is like nothing outbeats that, right? And I sat there and watched this patient beat that because of the mind and narrative and stuff that she was telling herself and what she was going through and what she hasn't like stood up against yet. And I completely revamped my whole practice to focus on mindset. Like this, that was such an aha moment for me.
Wow. Absolutely. And thank you for, looking at that and taking that so seriously, because you're right. I mean, the mind is the most powerful thing and it can override anything. So many studies done with Dr. Joe Dispenza talking about, studying the spontaneous remissions of people. And it was the people who believed 100% in whatever they were doing, like they were the ones that got the remission. And it's like the power of the mind is extraordinary. And I'm curious, so knowing that it's all mental, and I see this all the time, and it's like, why can't I stay consistent on my diet? Why can't I get myself motivated? And all the time in the background, it's like they're experiencing grief, loss, family issues, boundary stuff. I know we talked about last time. And just, they don't know how to deal with that. And they don't know how to actually sit in their emotions. They don't know how to process that. Is there much that you do how do you help them with their emotional stuff?
Yeah. So I actually focus on that first now. And so people don't know what they don't know sometimes. And so they come to me because of weight loss. And we also deal with diabetes, hypertension, all the stuff that comes with obesity. So they come with me for weight loss. And I'm like, okay, we will treat your weight loss, but we're going to treat your weight loss by dealing with all this stuff, so to speak, that hasn't been dealt with, And so I completely revamped the way I dealt with patients. So patient no longer came in and we do, here's your nutrition plan. Here's your exercise plan. Go see the psychologist, go see the cardiologist, like all that kind of switched around for me. I wanted to know who they were, what they went through, what their triggers were. Did they have any childhood traumas? Did they have what were triggers for them? Work, stress, how are they dealing with that stuff? Because all of that affected their weight loss. So I switched around the program to identify that with them first, because sometimes they didn't even know that they had all this going on. And then we came up with ways to deal with that. And believe it or not, when we dealt with that first, the weight loss automatically started loop going, because it's almost like all of those struggles that they were dealing with internally was outwardly causing medical problems. And there's research to show ACEs and other events that happen in the childhood or adult can manifest as medical problems. So your struggle or trigger that you had at 12 could be causing your obesity and diabetes. Like I talk about that a lot. And so we have to deal with all that stuff in order to move forward, even before, because you can't do the nutrition plan that I want you to do or you want to do if we're being blocked by a lot of this stuff that happened before. So that's the way I deal with that now.
Absolutely. Yep. We talk about sex abuse and like lots of people who are estranged from parents or from
Mhm.
siblings. And they say, you know, I'm totally good with it. Cut that person off. And it's like, is your body good with it though? Like,
Correct.
right? It's like the body holds on to trauma and it will build up this barrier in the way of eating and fat to feel
Yep.
safe enough. And it's like everybody's inside their own head saying, why can't I stop eating? Why can't it's like, well, because there's your body actually feels you're unsafe and there's
Correct.
still things happening day to day that are triggering things that feel like, oh, it's just work, but it's like work is actually reminding you of this memory based on the past when XYZ happened. It doesn't even need to
Correct.
be that big of a deal, but unless we're actually processing that, you know, and then clients naturally, I just got off the phone with a client who was graduating from our program and she was saying how, you know, she's not judging herself anymore. She's not walking around constantly being her own worst critic, like in this
Correct.
isolated box. And then the
Yep.
group program that we have, she was like, it had to be the group. She was like hand in hand for like me to practice being vulnerable and seeing that people can actually accept me the way that I am, like my weirdness,
Yep.
like every aspect of me. And then I could feel better about me. And then there's no longer that need to, at the end of the day, like try to numb out on the fact that you didn't get
Yep.
to express yourself at all during the day. Like it's just no way to live, not enough connection. Yeah. So wow.
Yeah, no, I 100% agree with that. And I think being in a community where you can feel vulnerable is also part of that, right? Like a lot of my patients trusted me there. And I literally have a sign in my office, like no judgment zone, like we're all here, you know what I'm saying, to help you. And it's almost like when they first come in, being able to kind of just relax, like this person cares, this person really wants me to get better. And we have everybody in this office or community or online or wherever you build that is all here to do the same thing, right? We have to change that narrative in our head. I call it positive self-talk. There's so many different ways to kind of go about that, but that has to change. Like what is being played in our head about ourselves? You know what I'm saying? And you're right. We're usually our own worst critic. And it's almost like, stop, you got to stop, you know?
100%. Yep. And we don't even realize that we're doing it. When I will
Mhm.
say to our clients, like, we want to invite you to be just the same you're saying, like, it's no judgment zone, but fully self-express. Because if we see the way that you are just automatically talking and speaking about your life or work or a relationship or whatever, your body, your
Mhm.
food, it's like we're going to be able to get a snapshot of what is the dialogue going through your head that is making these things so painful or scary, or you know, it's, you know, the forbidden fruit effect of like if you are calling sugar the worst thing ever, bad, like, you know, all the research and science about how it affects the body, it's like, yes, that is true. And how do the labels that we are placing on it
Mhm.
about it being like a you can never have this,
Yep.
making it that forbidden fruit effect where you're like, I'm going to have it, I'm going to have all of it when the stress comes. It's like you've been white
Yep.
knuckling it for years and years. Sounds like that patient that you had, you know, and then 2 years and then all this stress happens and it's like, forget it.
Yep.
Right. And that was my
Correct.
experience too. I had 3 years of no sugar, no flour, no alcohol, no snacks, weighing and measuring my food. I knew how every food affected my body and it worked while it was working. But then as soon as like relationship stuff came up for me in my life, it was like, all bets were off and I
Forget
gained
it.
a whole bunch of weight fast because I was just masking it with this
Yeah.
program and not actually doing the necessary work required to have that permanent weight loss where
Correct.
you can stay consistent all the time. I love that your patients saw that they started to lose weight just from doing that.
Yeah.
So I'm curious because obviously you do both, which I love. And I've had clients who they came to me. I have one client, or in the past, she graduated now, who she came to me because her gastric bypass surgeon said, before you can do this, you need to do some mindset work and
Mhm.
emotional mastery work
Oh,
on the
thank
food.
gosh.
Thank God they
Yeah.
exist. And she still was considering the surgery, you know, as she was in the program. So how do you recommend or not like, are there certain people that you say, you know what, I think just the mindset is what you need and it's not worth the surgery, or the people that you do recommend both? How does that work?
Yeah. So I think part of it depends on how much weight they have to lose. So what I've learned now is that mindset has to go first for sure, like 100%. Like I personally don't do it any other way. And kudos to that bariatric surgeon, because where I'm at, there's not a lot of people that are on this boat yet. I'm trying to like talk about this and bring so many people onto this where we're at, right? And so you have to do the mindset work first and then surgery. I always just assess on how they do. If they have like less weight to lose, right? Like maybe 50 or 60 pounds, they may be able to do just the mindset work and not need surgery. But people who have more weight to lose, 100 or more, they still will probably need the surgery just to kind of help get them where they need to go, but they'll be a lot better equipped to kind of deal with the surgery journey, which is a whole nother, you know what I'm saying, journey in itself. So they'll be better equipped to deal with that. And then they know themselves better. They know their triggers better. They develop coping skills, right? That's why my patient for 2 years and kind of your story of 3 years, like we did enough to get along, but there was no coping. And then something happened and we're just like throw our hands up, like forget it. Right. So it's kind of developing that resilience, that coping mechanism, that positive self-talk, all of that stuff first, and then get the surgery. So I think people could go either way. For me in my practice, it really just depends on their medical problems, like how severe they are and how much weight they have to lose.
That makes total sense. Yep. And what I was going to say with that is of course, I just lost my train of thought. The mindset aspect and doing that first, and then the surgery coming later, depending. Oh, I know what I was going to ask. So do you find, because I've had clients who, because of the messages in childhood, it'll be like their grandparents will say, oh, in order for you to attract a partner in your life, you're going to have to lose this weight.
Mm-hmm.
In order for you to be able to be successful in your job, you're going to have to look a different way. And, a big part of hypnosis for permanent weight loss is being like, no, actually, you can do all that stuff now. Mm-hmm. If you're able to get past these fears or these thoughts of like, I'm not able to succeed in X, Y, Z. And then once you prove to yourself that like, I can make those things happen right now, then all of a sudden there's this different world where they can actually get past the fixation with needing to lose the weight and just kind of move into like acceptance and trusting that by continuing to practice the coping mechanisms, emotional mastery tools, et cetera, that over time they will hit an equilibrium stage. Now, I'm sure for some clients where the weight, is significant, it would still make sense. But I'm curious, like, is there ever like a almost gray area where it's like, oh, I think this woman still could make it even though she weighs 250 pounds or weighs 280 pounds? Like, and there's, it's like, it could go either way even more, because it's like, yes, but will she have a bigger transformation if she realizes that even with her 270 pound body, she can still make stuff happen in her life?
Yeah. And we do that all up front too, like exactly what you're saying. So when I have patients, because I've had patients in the moment actually not get jobs. So unfortunately, it wasn't their grandma, it was their actual job say no, you know what I'm saying, which is horrible. But what I say to them, they didn't need you anyway. You know what I'm saying?
Yeah,
like you need to go find you another job. They didn't need you. You're worth more than what they're offering you. You know what I'm saying? And so usually that's kind of the way I frame it for my patients. And then they go find another job and they love it, right? Like for me, being miserable in your job in general is a red flag. So I always talk about pieces of pie that contribute to your obesity. Childhood stuff, your environment is one. I have a thing called 4 pillars where it's environment, behavioral, mental, and then medical conditions. So if your environment's that's toxic, right? Like it probably with you got to get out of that environment. That's going to hinder what we're trying to do. So yes, I've seen people who are higher weight that lose 100 pounds. You can lose 100 pounds by working on mindset. It just depends on where they want to be, right? And so, or they make it to 50 and it's like, you know what? I've done really well and I want more, I need more help. You know what I'm saying? So I don't force any, and this is probably where being a bariatric surgeon, like that's what I do. And I actually don't require any of them to go through surgery. It's like, what do you want to do? Like I always empower my patients. Like if you want surgery, we have to go through this mindset stuff first. If you don't, and then who knows, at the end of 4 months, 3 months, you may not need surgery. So I often leave it up to them. I've had people who were on the surgery track and did so well that they didn't need surgery. And even my surgery patients, they do better and keep it off permanently, kind of like what you do, because they did the mindset work first. They don't regain 2 or 3 years later. So that has to be a component of it.
So good. Yeah. I love that you get to be like that empowerer. Like I can see that you would be the perfect person to be like, they don't need you anyway.
Yeah, exactly.
Go get a different job.
Yeah,
like that's what they've been needing to hear since they were probably like 5 years old and never had the parent to just be like, nope, keep going. Like you can do it. That's fantastic. Yeah. And thanks for sharing that. I have a different client. She was the same one I just talked to earlier. And she was hearing the other two clients talk about how in the past they did the gastric surgery and she still, had a fair amount of weight. She had gotten past the judging herself. She had been doing all the inner work. And she was like, well, I am still thinking about like, well, what if I should get the surgery? And I was like, listen, we are here to empower you in making whatever decision is going to support your life the most. What we're always on the lookout for, though, is that whatever that decision that you're making is coming from a centered, this is what I know that I want to do. I'm aware of everything that's going to happen here. I have a system of support set up for myself after. I've proven that I can like emotionally handle hard things because surgery is it's going to be painful. There's going to be like all these things like, like the stress in that in and of itself can be a trauma that could lead to things later in life as well. So yeah, I love to hear that. And like, do you kind of get that sense when someone comes to you? Because when someone comes to me and they come frantic, because I've had people also call me and be like, I can't handle it anymore. Like I need to get this weight off. I'm going to get a tummy tuck. I've been Googling it all morning. And immediately I'm like, no.
Yeah, exactly.
Like this is anxiety. What happened? And it's like, we dig a little bit deeper and it's like, I got into a fight with my parents last night and blah, blah, blah. And it's like, all right, let's work on that. And then they get through the work and they're like, okay, the tummy tuck idea was a bad idea.
Yeah.
And it's like, we as human beings, that's when we're making decisions is like when we're in such emotional states. So it's like stabilize the emotions first, then be with what is, and then we're here to support you with whatever decision makes most sense for you next. And I have supported clients with going for surgery after. So sounds like we're on the same page with that.
Yeah, no, I totally agree. Like, because I also do cosmetic. I do some of the skin removal too. And then, so I'll have patients that are like, I just want to remove this. And I'm like, that's not going to work without doing like all this other work. And for your audience, like surgery is a lot. Like I've had, if you don't have support, family support, it's very hard. So a lot of my patients are eating differently than the rest of their family. And that's hard. There's so many, like after the surgery, like so much stuff that my patients say they deal with that's new, even before they ever had the surgery. It's a huge exchange, right? You do the surgery, exchange the surgery for what? Like you have to think about what you're going to have to give up. When people come to me and are like, oh, I need to go to a wedding, so I need to drop 50 pounds, I want to get surgery. That's absolutely the wrong reason to do it, because most people, if your family is not supportive, everything in your life changes. Like the way you eat with your family will change, your portion size change. Funerals, you know what I'm saying? When you go I've had people Thanksgiving and Christmas, they don't want to go or be a part of anymore, which is another separate anxiety now because their family doesn't understand why they can't eat this like spread of mac and cheese and pumpkin pie and all this other stuff. And they're saying no, you know what I'm saying? And they're like, what's wrong with you? There's a whole nother dynamic with that. So then they don't go to that anymore, which brings about a little bit of depression, a little bit of anxiety. I mean, there's so much that goes into surgery. Your body doesn't look the same. There's an increased divorce rate because the spouse is like, who are you? Like, I don't know this person anymore. Relationships feel different. There's so much of an emotional side to surgery. I just want to make sure your audience like knows that if you're thinking about that, the surgeon may or may not kind of dive into detail. We always go in the technical aspects like complications of surgery, how long are you going to be in the hospital, how much weight you're going to lose. But there is such a huge emotional component and a relationship component after surgery. Most people are not prepared for that. And so you can't just jump in and say you want to do this because you have what I call a fast brain moment, fast brain, slow brain, where you're just like a default. I gotta almost like you get it under, slow it down, deep breaths, however you want to do it, think about it, because it's a huge undertaking. So.
Oh my God, I so appreciate you sharing that. I'm so glad you brought that up. I don't know if I would have thought to ask that question, but I think that is huge to spell out of like,
Yep.
it's not just post-op pain and possibility of infection or complications,
Yep.
but also the emotional, sociological like aspects of this.
Yep.
Wow, that's huge and just major. And wow, increased divorce rate. I didn't even think about that, but that, it makes a lot of sense because you're going through a whole thing and it's weird. Almost like I feel like an identity shift, like
it is
that you're not even prepared for, but like you are, but like your body's happening, but like, it's like, I can just see
like,
how,
who am I? Right. And
yeah,
people
like,
look in the mirror and they don't see themselves anymore, which is a whole nother, or they still see themselves bigger than, there's a lot that goes on with bariatric surgery. So, the foods they can't eat anymore that they used to be comfort food to them, it's that you're taking that away. And if you eat it, you're going to get super sick, end up in the hospital. All these bad things can happen. And they're just like, what do I do? You know what I'm saying? So it's just a big undertaking. So
absolutely, which again is the emphasis of why they need to do the mindset work first, so that whatever comes up that we can't prepare for, you're going to have to go inward and take a look at it and use the tools probably even more as to be successful with it. Wow. Thank you. Thank you. Thank you so much for being here. I could talk to you all day. We're going to keep connecting and find out how we can keep helping more people in this area. So I understand you have a book and you have an app. So if you could please share with our audience, I'm sure people would love to know how they can connect with you.
Yeah, so I'll share briefly. So the book I came out with was Transformation is a Mindset, Changing Your Input and Change Your World. And it's almost everything that we've talked about, everything that I saw in my practice and how sometimes people can self-sabotage themselves. So it kind of goes on my journey and how I corrected it, and then hopefully gives pointers on how people can at least recognize it, which is the first step. I give out like steps on how to recognize it, give multiple stories in there, and on how to kind of get through that. So Transformation is a Mindset. It's on Amazon. It's on all the bookstores. And then, yes, I am Chief Medical Officer at Fresh Try. One of the reasons I joined them is because it's the only app that does mindset training in order to lose weight. And so this is so important to me that I literally went down half time in my own practice to be able to help more people. So I joined this company in order to be able to kind of spread the word on this mindset and how important it is, because I saw it even with my own surgeries, the most powerful tool that apparently you have. I saw my patients overcome that because of their mind. And so it was really important for me to be able to scale this knowledge and be able to help more people. And through this app that everybody can download for free, it's called Fresh Try. You can download it from any mobile device. And we go through mindset live sessions. It trains you on how to create better habits, how to be more positive, positive self-talk, how to be grateful for the things that you do and intentions. So we don't do the typical tracking where you're like, darn, I ate the wrong thing and you feel like you're a failure. We don't do that at all. That method to me is outdated. We do practicing, almost like what you do, very similar in your practice. We practice different habits and then make tweaks along the way. So we never fail in this app. Yes. We just keep redesigning and retweaking based on the mindset training that we're learning in the app. So I would recommend everybody who's struggling to try it out. I can be found on all my Instagram panel, Dr. F. Hamilton, my Facebook, Dr. Franchell Hamilton, LinkedIn, Dr. Franchell Hamilton. Everything is Dr. either F. Hamilton or Franchell Hamilton.
Awesome. Perfect. Well, we'll make sure that we have all that stuff in the show notes as well. It's the Fresh Try app, and Transformation is a Mindset book. We are just going to keep waving that flag. Thank you for doing that, and right along there with you. And we'll keep finding all the other doctors out there that are in alignment with this so that the world can change, because this is at the source of the healthcare crisis that we are going through right now, in my opinion. and
I
sounds like
agree.
yours as well. So thank you, thank you, thank you. Maybe one day I'll be on that app with you. We'll see about
Would
that.
love
Keep
it.
waving the flag. Awesome. Thank you so much for being here. Have a great rest of your day. Thank you, everyone.
Thank you.
Bye.